Good afternoon. Welcome. We're convening the House Appropriations Health and Human Resources Subcommittee. I'm your chair, Delegate Rodney Willett, and thank you for being with us. It's been a pretty busy Friday afternoon for appropriations, a lot of meetings. What we're going to do, we actually have a couple of bills I think we can get through pretty quickly, and then we're going to have a presentation on CSA. So let's go ahead and do the bills first, because I think we can get them taken care of in a matter of minutes here. And I'm going to, since he's in the room, there's a doctor in the house, yes. And we're going to have Delegate Mark Downey join us to talk about his bill, which is HB 525. Oh, and I forgot the roll. I got so excited. We were rolling without the roll. So if we can get the roll, that would be great. Thank you. Okay, we've got a quorum here. Thank you. Dr. Downey, now we're with you, Delegate. All right. Doctor.
Good afternoon, and thank you, Mr. Chairman and members of the committee. I'm pleased today to present House Bill 525, the Reach Out and Read bill, connected to Budget Amendment Item 292, number 2H. Before I get into this, I just want to point out that I did not speak to this amendment this past Wednesday because it was attached to this bill, but I did want to point out to the committee that this is actually one of my top priority budget amendment ask this year. So HB 525 with the budget amendment asks for $252,000 general funds with matching non-general funds from the federal government of $468,000 to provide money to go to the Reach Out and Read program. This Section 1 bill directing the Department of Medical Assistance Services to initiate the process of expanding Reach Out and Read to currently underserved communities across the Commonwealth, which there are quite a few clinics around the Commonwealth that are on the wait list. Reach Out and Read, what it does, the program, it provides a book at each well visit from birth to 5 years of age, so approximately 14 books in those 5 years. It also helps lessen the blow of the vaccines that are offered to the kids at those visits. By providing books like the ones I brought here, am I allowed to show props? All right. At the primary care appointments, pediatricians promote early literacy and parental bonding between children and their parents. Reach Out and Read is an in-demand program in Virginia. However, many pediatric or family practice clinics do not have access to the program yet, but they serve countless children on Medicaid across the Commonwealth. Not only does Reach Out and Read program promote child literacy, has been shown to improve children's attendance at their well child visits to make sure that we can identify developmental delays early and get them referred over to the appropriate medical resources. And furthermore, it keeps our children on track as it oftentimes improves their language acquisition by up to 3 to 6 months. The benefits of expanding the Reach Out and Read program are immeasurable for Virginia's children and their families. By passing HB 525, Department of Medical Assistance Services will be given the necessary permission to support pediatric and family practice clinics in the most underserved areas who are on the waiting list for the Reach Out and Read program. I'm asking for your support of this legislation. It's very dear to my heart. It's been one of the most rewarding aspects of my day when I'm giving out these books to the kids. And as a pediatrician, I've seen the positive impact of this on across the community, and I hope to have your support.
Great. Delegate Downey, thank you so much, and thank you for what you've done. I know this is real passion for you, and you've done so much for your patients related to this, and obviously you're trying to share the love and help others who are not as, other areas are not as fortunate to have that access, and it's certainly super important. Are there any questions from the committee, from the patron? If not, I'll entertain a motion.
Mr. Chair.
Yes.
Mr. Chairman, I have a motion, but before I'd like to also applaud Dr. Downey. I've been to the facilities where the things are getting out. I've been heard from about this program for the last 2 or 3 years. I think it is a fantastic program. Unfortunately, right now, Mr. Chairman, I'm just going to ask if we can gently, at this point, lay the bill on the table.
Gentle second.
We have a motion that's been properly seconded to gently lay HB 525 on the table. All in favor? We can just do that, that's voice. So, yeah. All in favor, say aye.
Aye.
Any opposed? No. And just to make a note on that in our process. So staff is working quite diligently right now trying to look at everything we're dealing with from the current budget and holes there, federal impacts, and then, oh yes, we have hundreds of additional amendments before us. And so, yes, we're sorting through that, and recommendation was to go ahead, put these bills on the table. That does not kill the idea, and you still have a budget amendment.
Yes.
In addition to this.
We need to we need to record the vote.
It is recorded. I thought it was recorded. Okay, sorry about that. I got carried away in talking about that. We are going to record that vote. Yeah. And then by a vote of 7-0, HB 525 is gently laid on the table. Picking up where I left off is just the process here. We're putting this on the table for now. And continuing our evaluation of what our options are for it. So we will certainly get back to you and others. But again, as you've heard from several of us, really appreciate your efforts, and please keep that going.
All right. Thank you for your time, Mr. Chairman, members of the committee.
Great, thank you. We've got 2 more bills to look at, and we're going to talk, we hear from the dais talk about these 2 going to HB 136 from Delegate Reed, which is related to a sickle cell disease Medicaid benefit feasibility study. And what else can we say about that? You want to, yeah.
Mr. Chairman, this is Delegate Reed's bill. It would create medical health homes for individuals with sickle cell disease that are Medicaid eligible. And it's a feasibility study, and as a number of you know, over the years, typically Medicaid will need additional resources for a contractor to help develop that feasibility. So there is a fiscal impact of $250,000 general funds and matching Medicaid dollars in fiscal year 2027. And again, it would be a feasibility study.
Any questions from the committee on this? I would do my best to try to answer those. I am familiar with the ask there from Delegate Reed.
Thank you.
If not on this, I'll entertain a motion on this one as well.
Mr. Chairman, I move to lay this on the table.
Second.
Thank you. We've got a motion that's been properly seconded to gently lay on the table HB 136, and again, this will be recorded. And by a vote of 7-0, HB 136 is gently laid on the table, and to make the same comment here that, again, we're still getting arms around what our options are. Very important question to be answered here about the study, but again, we need to look at what our resources all are. And then, last but not least, we have HB 376 from Delegate Seabolt.
Sorry.
Yes, we'll have Susan
Mr. Chairman, this is HB 376. It would create in the Office of the Chief Medical Examiner certain actions that they would take upon the finding that an individual died from sudden unexpected death in epilepsy. They'd have to refer a case within 30 days for investigation to unspecified public or private institution that would provide the decedent's next of kin with information on the benefits and the process to submit information about the decedent to the North American SUDEP registry. But it does have a fiscal impact for the Chief Medical Examiner's Office, largely for a position, possibly a nurse, that would work with the families in informing them of how this would work and what information would need to be passed along, and try and maintain the website on a current basis on all things related to SUDEP and their office. The impact is $142,671 general fund annually.
Mr. Chairman,
Yes.
I have a motion to gently lay this on the table.
Thank you. We have a motion that's been properly seconded to gently lay on the table HB 376, and we'll go on the board. And by a vote of 7-0, HB 376 is laid on the table, and that completes our legislative docket. But we have a great presentation coming up on a really important issue, and looking forward to learning more what's going on in CSA. Come on up.
Yes, good afternoon, Mr. Chairman and members of the subcommittee. My name is Scott Reiner. I'm the Executive Director at the State Office of Children's Services. And I want to thank you for the opportunity to brief you on the budget for the Children's Services Act and say that I am cognizant that I stand between us and either the weekend or the bomb, tornado, or whatever it is that's coming next. So I'll try and keep that in mind. As you're aware, the CSA, which is managed by my office, plays a vital role in maintaining the safety net for essential services to some of the Commonwealth's most vulnerable children and families by providing reimbursements to local governments for the costs they incur for providing services to children in the foster care system, those who require special education services outside of the public school setting, and children with significant behavioral health challenges. Let's see. Oh, do we have slides?
I apologize. We are trying to get those up.
Okay.
The whole time.
Yeah, I didn't look up and I didn't see the slides.
Presentation be online, Mr. Chairman?
It will be online once we get that up. So bear with us 1 second, and
Yeah.
we'll get that back. Thank you, Scott.
Help has arrived.
Do you mind? Yeah, I don't know. Doesn't seem like anything's loading.
It's usually right on the desktop.
Yeah. Normally, this should be filled with loads of things.
Okay, let me make a call.
Okay, screens are oh, there we go.
you're
Screens
right.
are flashing. Okay, Scott, we're back to you. Thank you. Sorry for the interruption.
So I'd just like to begin with giving you a brief overview of the expenditures in CSA and what we see as the primary drivers of the costs we're seeing. And just to lay a little context for members who may not be overly familiar with the way CSA works, is that the General Assembly, well, let me start by saying it's worth noting that the CSA is structured as a sum sufficiently funded program. And that these sum sufficient funds account for the overwhelming majority of CSA expenditures. Our enabling legislation specifies that the General Assembly and local governing bodies are required to provide funds sufficient to meet certain needs of children in designated eligibility categories. So, and those are children in or at risk of entering foster care, students whose educational plans, individualized education plans for students with disabilities, specify that they be educated in a private educational setting as opposed to a public school setting, as well as children in need of services. Those are some sufficiently defined populations. So it's important to know that many of the decisions about those services are made by entities outside of the actual control of the CSA and our local enabling agencies. Specifically, local school divisions decide who gets an IEP specifying private setting for their education. Local departments of social services make many of the decisions about what services children in foster care receive. All services ultimately must be approved by a local community policy and management team, which is the enabling entity in the locality that oversees the CSA program. So I think that's important to know as a context for understanding our expenditures. It's also important, as you heard in that sum sufficient language, that the General Assembly and the local governing bodies must appropriate funds. All CSA expenditures require a shared fiscal responsibility. The state provides an average across all localities and all services of approximately 65 cents of every dollar that's spent. The local governing bodies are responsible for the remaining 35% of those expenditures. Certain services, each locality has its own base rate, which is based on an ability to pay formula, and different services carry with them different variations of those base rates. What we term community-based services, which is while children reside in their homes. The base rate is adjusted to give a 50% discount to localities. So the state rate goes up 50% against the locality's base. If the service is provided in a residential or a congregate care setting, that base rate is carries with it, we call it a disincentive of 25%, so that the locality pays an additional 25% above their base for those services. This three-tiered match rate will be important, and I hope you'll hold a pin in it as I discuss some of the proposed savings that are in the introduced budget. So this is I'll begin with a 10-year, with several slides providing you a long-range overview of the major cost drivers for CSA. The data in all these slides represents the combined state and local expenditure. So if you want to look at it simply from the general fund perspective, all of those expenditure data are on average 65% of what I'm showing you. The first slide provides a 10-year look at expenditures as plotted against the CSA census, or the unique number of children that we serve in any given year. In the earlier years of the CSA, which began in 1993, was the year it was enacted and implemented, expenditures rose gradually, with the census being relatively stable. So the blue bar is your expenditures, the census is in red. Over the years of the COVID-19 pandemic, the census declined markedly and expenditures flattened out. Over the past 2 to 3 years, as we've emerged from the pandemic, both the census and expenditures have been increasing markedly. In the most recent fiscal year, that'll be FY25, the census was just over 16,000 children and families, and the total combined expenditures were just a hair over $600 million. This next slide shows those same expenditure trends over a 10-year period in each of the 5 major service types that we cover. You can see that the most rapid growth, which is the red line, that corresponds to the growth in cost for private day special education. Foster care, which is in yellow, residential treatment in blue, community-based services in green, all increased at similar but much more moderate rates. So that's the kind of drivers of cost by category in the last number of years. And if you just take that per child, annually per child, this is a 5-year slide, you can see that private day special education is the most costly service, averaging just over $60,000 per child per year. Residential treatment runs about $45,000 a year. Foster care around $20,000, and community-based services and other smaller pots of money at less than $10,000 per year. This slide just shows for FY25 alone the distribution of expenditures and provides a consistent picture with that you saw in the prior slides. In descending order of what we spent last year, $268 million for private special education, that's the big green slice. $135 million for services in support of children in foster care, $85 million for community-based services, $50 million for residential treatment for youth in foster care, primarily those in group homes, and $40 million for other residential care costs, which are not covered by Medicaid. For children who have Medicaid, many costs are covered and they don't show up in the CSA budget at all. Medicaid pays for them. And this final slide summarizes the relative contributions to the CSA expenditure compared to the census. And you can see that, the more expensive services, although they account for less % of the children served, account for more of the money. So that's what it looked like last year. So the takeaways from this are the following. Our census has been rebounding pretty considerably after the pandemic ended. Children and families emerged, and the behavioral health and other related needs that they're experiencing, showed back up, as we might expect. For FY25, if you look compared to just FY22, expenditure average increase was 9% a year. That included the tail end of the pandemic. If you just look at 24 to 25, the increase was 13%. So you can see that it's kind of on an accelerating pace. The largest areas of growth are private special education, community-based services, group homes for youth and foster care, and treatment foster care, an important service that the Department of Social Services relies on pretty heavily when they take children into custody. Expenditure growth is a complex function, but it's accounted for by both census increases as well as increases in provider costs for the same services year over year. So I'll take a break there before I go into the introduced budget just to see if you might have any questions you might want to provide. Yeah.
Thank you, Scott. I'm going to go to Delegate Tran.
Thank you so much, Mr. Chair. I've heard some conversations around, piloting public day schools for special education, and would love to hear your thoughts on that, seeing how large of a cost it is for the private day.
Yeah, thank you, Mr. Chair, Delegate Tran. We have been wrestling with the issue of special education outside of the traditional public setting for a long time, as you know. And this year there are renewed efforts to initiate and or fund public-private, I don't know what you called it, but they're publicly operated but separate schools, public but separate. Without having, there are several of those already operating in the state, as you may know. The Southeast Virginia has a program based in Chesapeake. There's a program in Stanton, I believe. There's 3 or 4 or 5 of those that are funded exclusively through the Department of Education. And there's a kind of parallel piece of funding in the Department of Education budget called CISNA, support for intensive needs students. That's a fairly large amount. And that is used by local school divisions to pay the tuition, if you will. We do understand that those programs are generally less expensive to operate than the private programs. And I certainly think they're worth exploring as an alternative. The concerns that we might have if CSA funding were to be used is that it might, you know, on the one hand, folks say, well, that will lower your CSA census and your costs for non-traditional public schools. We have some concerns that it might result in a net widening, that the students going to private day school might continue to go there. Anybody already there, they can't be returned to public school without their parents' consent, the way the law works. And it's possible that students who, you know, are being maintained in the public school with some struggles would be placed in these separate public programs, and it would really potentially expand the scope of the CSA responsibility. But if those programs make sense, and I think there's a lot to be said for them, just from a policy standpoint, I'm just speaking for myself now, I think they should be done through the Department of Education. And that makes sense. We don't even have a structure to, we fund students on a per student basis. To stand up and operate a program under CSA, we would either have to undergo a major restructuring or those programs would have to kind of cost out like a business model. Well, how many students would they get at what price that CSA could possibly reimburse for? Additionally, the match rate that I mentioned earlier is for most localities a significant improvement over the local composite index. So it would fund school programs at a rate very different from public education. So I think I'll stop there and see if you have other questions.
Thank you very much. That's very helpful.
Good questions. Scott, I think we're good.
Okay.
Thank you.
So now I'll talk to you about the introduced budget, beginning with the caboose bill, which is House Bill 29. And even though we did get a significant increase in the Appropriation Act for the second year of the biennium, the forecast done for us by the Department of Planning and Budget suggests that we're going to require another 4.7% on top of the 6.3 that we already had to meet FY26 requirements. So as you can see, it's an additional $20 million in the caboose bill, and it accounts for about an 11% year-over-year increase from the prior year, FY25. Excuse me. There we go. So now I'll talk to you about the introduced budget for the full upcoming biennium. And again, most of this is based on the forecast that DPB does for us. So in the proposed budget, the forecast calls for almost 10% additional funding in the first year and 7% in the second year. And it amounts to about 14 or 15 million and an additional 35 million, give or take, in the second year. The non-general fund piece of that, although CSA is almost exclusively funded with state general funds, we do receive a small pass-through federal amount under the social service block grant of about $9 million. But elsewhere in the budget, the Department of Medical Assistance Services has language to cap certain automatic rate increases that CSA also provides funding for that service. So if those rate caps were to go into effect, there would be some savings against CSA from that. So it's a pretty significant increase that was in the governor's introduced budget. Those amounts are reflective of two amendments that were in the introduced budget. And the first of them in item, these are what I consider cost containment items. On item 271, letter U, it restricts the growth in the rates that CSA will reimburse localities for the daily tuition cost for students in private special education programs to 2.5% above the rate we're paying in the current year. In this year, FY26, we're operating under a 5% cap that the General Assembly provided for last year. This amendment, which will save approximately $3.5 million, sets that cap at 2.5%. So if we were paying a school $100 a day this year, next year we would reimburse no more than $102.50. The programs that provide the services and the localities could make whatever arrangements they like to make pay rates above that rate. The state just won't reimburse the locality for any additional amount above the cap. And in fact, this year, that's already happening at the 5% level. The second cost containment strategy is found in item X, and this modifies our current three-tiered match rate. I mentioned it, which I asked you to kind of put a pin in, the 50% additional reimbursement from the state on community-based services. This amendment would change that. Currently, for community-based services, the average state contribution is 83%. This would limit that to 71%, resulting in a lower, instead of 50%, it'll be much lower incentive to use community-based services. And the anticipated savings for that are $11 million the first year and $12 million the second year, if in fact localities continue to spend consistently for those services at the rate they're doing. And as I mentioned, the proposed caps on some service in the Medicaid budget will save about $1.3 million the first year and $2.4 million the second year. That's kind of, we're just the downfall beneficiaries of that change in the Medicaid budget. Our administrative budget to run my office has no new items, no new requests. That $3.1 million goes 90% to fund the 16 employees I have that help administer the program and our administrative costs, and there are no changes to that budget. And with that, I have reached the end, and I'm happy, appreciate your time, and I'm happy to answer any questions or hear any input you'd like to share with me.
Yeah, that's great. We're going to go to Delegate McLaughlin's got a question for you.
First of all, thank you, Mr. Reiner, for this really helpful presentation. Just wanted to ask you one quick question, and I might be wrong, so I'm going to ask the expert here, but didn't the most recent SLIQ study come out showing that while the cost of these programs are rising, they're not actually rising more than our surrounding states around us?
That study, and you recall that study correctly, I think it's about 4 years old. SLIQ took a very deep look at the private day special education CSA relationship. And I believe that's correct without, don't swear me to it because I don't have it in front of me.
Mr. Chair.
But Mr. Chair, Delegate McLaughlin, since you gave me the opportunity, the study also recommended moving that whole part of our program out of CSA back to the Department of Education. So just because you gave me the opportunity.
Well, Mr. Chair, so, certainly wasn't meant to put you on the spot or anything. It just popped into my head about that study, and I just find it interesting that we see that the cost is going up, but it looks like it's going up across all the state lines and things like that.
Mr. Chair, Delegate McLaughlin, states vary very widely in the way they handle this private special education for students with significant disabilities. Some states don't have any private system. Virginia probably has among the more robust privately operated programs. Maryland has a pretty good array. Maryland sets the rates for those programs by the State Department of Education sets those rates. So there's really a lot of ways that they can be sliced and diced and done. But I believe your recollection is correct. Costs are growing, for sure.
Mr. Chairman, just one final statement, and I promise I'll shut it up. So I just also wanted to, you did point out, and you're absolutely right, and I know a little bit about this. I have a family member that fits into this category. So, but these are some of the most vulnerable children, right?
Indeed.
And so, and a lot of them just cannot fit into a school setting. I just wanted to point that out. I know it's expensive. I know that we talk a lot about cost, but we're talking about some of the most vulnerable people in our population. Thank you again.
Thank you, Mr. Chair, Delegate McLaughlin.
It's super helpful. And Scott, I was going to come back to, I really appreciate the focus on the budget side, but going back to how we got to those numbers, and I'm looking at my notes, and it's definitely a question or a case of increasing costs. The census itself didn't, I mean, I know the post-COVID thing, that was inevitable, it was going to go up, but it's not like all of a sudden we're getting this exponential increase in the census. It's increasing, but it's not crazy.
Mr. Chair, if you kind of cross-reference the increase of census against cost, the increased cost of services is a stronger driver of the overall increase than the census is, if that's what you're suggesting, and that is correct.
Thank you, that's super helpful. Any other questions from the committee? I'm sure we'll think of something once you're gone, but we know where to find you, and we'll come back, Scott. No, I really appreciate you joining us on a Friday afternoon and being so helpful. Please keep up your good work, and as you keep hearing in these meetings, we have some daunting tasks before us a very daunting task to deal with these needs at a budget level, and we will keep doing our best. But thank you so much.
I appreciate it. Okay. Thank you very much.
Good. With that, there being no other business before the committee, we will rise. Thank you.
Thank you, Mr.